I hope you're all doing well. It's Dr. Allen with Your Place Physical Therapy, here to talk to you a little bit about frozen shoulder, or adhesive capsulitis as it's also called. If you don't know much about it, you want to learn a little bit more about it, or if you want to know how to prevent it, then tune in. I hope you get some good information from this, and I hope you enjoy. Alright, so frozen shoulder. What is it? You have a capsule around your shoulder joint. The bones, the tendons, the ligaments in there. Surrounding that is that capsule. And for a variety of reasons, you may start not being able to move that shoulder as much. It could be a surgery that you had. It can be an injury that you sustained. It can be a lot of different things that cause you to just not move that shoulder as much. And when you stop moving that shoulder as much, that capsule starts to tighten up. And then when the capsule tightens up, you can't move it as much even more, and then it starts to tighten up even further. And eventually that capsule gets to the point where it's so tight that your shoulder is frozen and you can hardly move it. So the goal is to prevent it from ever getting to that stage, and that's what I'm going to go over here in a little bit, but essentially that's what frozen shoulder is. Alright, so symptoms of frozen shoulder. You got pain, stiffness and lack of mobility, and weakness. The pain is usually the first one. That pain onsets for whatever reason, and then you don't move your shoulder as much because it hurts to move it. And then that stiffness starts to onset because you're not moving your shoulder as much. And then that combination of pain and stiffness has an effect on the muscles in the area, the inflammation as well, and that causes weakness in the joints. So you'll notice you aren't able to lift things that you used to be able to lift. You can't carry things you used to be able to carry. You can't move your arm and reach for things that you used to be able to get, even just weeks ago. So it onsets gradually, but once it starts to onset, if you don't take measures to reverse it, it can get really, really, really bad. Frozen shoulder sounds terrible, doesn't it? So I'm sure a lot of you want to prevent it, and you might be asking how you go about doing so. The first thing and the biggest thing that I tell all of my patients that come in with any sort of shoulder pain or neck pain or back pain is posture. You want to make sure to keep yourself upright, spine relatively straight in normal alignment, prevent that rounding forward of the shoulders that pinches up these muscles and tendons in the front and impinges them. That creates inflammation and issues there. It also causes weakness in the muscles responsible for stabilizing your neck and your shoulder. So that's the biggest thing. Second thing, if you're a side sleeper, I would recommend switching sides from night to night. So sleep on your right on Monday, left on Tuesday, and so on. That prevents constant compression of that shoulder joint in that area, which can easily inflame the tissues and everything in that joint. And as I mentioned, increase your risk for frozen shoulder. So on top of behavior modification, the other thing that I do for all of my shoulder patients, whether they're in for frozen shoulder or they're in for something else, is a comprehensive strength, mobility, control, and stability program for the shoulder. So those are the things you want to make sure you focus on to have optimal function of the shoulder and prevent any sort of injury risk and to rehab any sort of injury in the first place. So the only way to effectively do that is to get assessed by a professional like a physical therapist or a strength and conditioning coach. If you happen to have any questions about what you might be needing to do or what you might be doing wrong, you can feel free to reach out to me and I'll be happy to help you out as best as I can. But those are the things that you want to focus on: strength, mobility, stability, and control of that shoulder joint.